Welcome to our first virtual event, Consulting Without Borders Live Global Challenges. Thank you for tuning in. I know that you, our audience, can put in comments where you're watching us from. We would really appreciate it. I know that we've been watched from all over the globe. My name is Victoria Olskaya. I'm president of Gabriel Al-Salem Foundation. I'm currently in the United States, actually in Charlotte, in North Carolina. And with this digital format, we can be joining from anywhere in the world. So please, if you see us, if you're watching us, please type in the comments where you're watching from. We have Tim, Son, joining us. Hi, Tim. Good morning. Yes, it is morning in the United States. Thank you for joining. Thank you so much. Great. These are my actually colleagues from the Teams group where we are learning to live stream. So I'm very happy they're supporting. Hi, Anya. Anya Al-Salem is also tuning in from North Carolina. And Gulsum. This is Gulsum, our dear colleague in Kazakhstan, one of the members of the board of directors of the foundation. She's also watching us from Kazakhstan. Thank you so much. Really appreciate it. And hopefully we'll get more people joining in later. We had a little bit of a glitch with the timing because with all this moving towards the summertime, the clocks went a little bit off. So we hope we didn't disappoint anyone, but it is 9 o'clock in the United States. It's a little bit past 1 p.m. In GMT time. So I hope that we're not losing too many people who might have been off by 1 hour with this little bit change. In any case, welcome to our first virtual event, Consulting Without Borders Live Global Challenges. Some of you may have participated in our recent 10th anniversary conference, Consulting Without Borders, on February 1 and 2, and possibly also participated in our physical events, which we have been organizing annually since 2012. If any of the participants of this show have been in our previous events, if you could please type in, yes, I participated, I would really appreciate that. Well, good news. Now you don't have to wait another year to hear from us on February 1st next year. We have made a commitment to holding the virtual event Consulting Without Borders Live on a monthly basis. Each episode, you can watch experts in international consulting and business discuss the key global issues of our time and answering your questions live. So please stay tuned as we're developing the format and the content. And the content, we're also welcoming your ideas and suggestions and the topics that you would like to discuss in our future episodes. As you know, we at Gabriel Al-Salem Foundation are very much focused on global issues, and our mission is to contribute to sustainable development goals and better future for all. Our slogan is building connections, promoting excellence, creating sustainable growth. Today, we will focus on Sustainable Development Goal number 10, which reads as reduce inequality within and among countries. And we will do that in connection with the phenomenon that has been affecting lives of every person on this planet for over a year now, COVID-19. It is partly because of COVID that we are streaming right now, but of course, COVID brought us not only the inconvenience of a lockdown, it has caused deaths, brought health problems, and brought severe economic hardship to many. Has this impact been equal within and among the countries? Probably not. And this will be the topic of our discussion today. Actually, this topic has been proposed by my dear colleague, one of the members of the Foundation's Board of Directors, Stephen Tupper. He is here. And those of you who know us and our work also know Stephen. He has been very active participant of all of our events in the past few years. He's been supporting us. And Stephen has been working for more than 35 years as international development consultant in many countries in Europe, Asia, in North Africa, Middle East, and in parts of the Pacific. And he's been working specifically on issues related to poverty reduction and regional development and governance. According to Stephen, he prefers working bottom up rather than top down, and to ensure that problems deliver results for wider stakeholders and the general population. Let me also briefly introduce our special guests today. We have a great pleasure to welcome Mitch Weiner. Welcome, Mitch. So good to see you. Mitch and I actually met and worked together back in the 90s in Kazakhstan on pension reform, and we haven't seen each other since then, so it's great to have Mitch here. I really appreciate that you could join us today. Mitch has over 40 years, actually 44 years to be exact, of consulting and actuary experience, and over 25 years of international development experience. And he's been focusing primarily on Eastern Europe and Southeast Asia. He currently works for the World Bank as Senior Social Protection Specialist, and he's joining us today from Washington, D.C. Our other special guest is joining us from Nigeria. Judith Ogedegbe already participated in our conference on February 1st this year, and she spoke on diversity. Judith has over 20 years of international and management experience. She has worked with governments and the public sector across Africa and also in the Middle East and in the United States. Judith is passionate about driving change that leads to sustainable growth and profitability. Judith currently serves as Executive Director of DAI in Nigeria, a global development company operating in over 100 countries across the world. Judith is also a certified professional coach and provides life and business coaching to individuals, executives, and business owners. Thank you to you all for joining. And now I would like to let Stephen take the initiative and start the discussion of whether COVID-19 impacts inequality within and among the countries. Stephen is usually somewhere between the airports, but right now you're in Scotland, right? Correct?
Yes, correct. I've been stuck down here due to lockdown since last March, actually, because all of the places I need to travel on to, including my home in Bulgaria, are closed. Yep. So this is the first impact of COVID. But when we talk about the impact of COVID on inequality, we don't have the luxury of actually looking at the pandemic in retrospect, because it is an ongoing problem. So many of the observations and conclusions we want to come to today can only be tentative, because really this discussion needs to be in 2022 or probably even 2023 if you want to look back on the impact of the pandemic. But I suggested this topic because more and more data is appearing which suggests that the pandemic is having a negative effect on equality, or how can I put it, sustainable livelihoods for many people. Very often this is seen in terms of the economic impact of the pandemic. Now, of course, the pandemic has had a negative impact economically on most of the countries I work at, with a fall in GDP in 2020. I again say subject to final data results, but it has a major impact on the capacity or purchasing power in the developed world, which has an impact in turn upon the economies of the more developing countries. However, I don't think that the impact of COVID is restricted to economic affairs. Let me give you an example. I'm afraid it's an example from a developing country, i.e. the United Kingdom, where COVID is having an impact on access to health for different strata and ages of the population, as resources have to be devoted to fighting the pandemic. Obviously, there are less resources available for the provision of ordinary healthcare, and this has a social inequality impact because many of the forms of healthcare that are required by those on lower wages for dealing with things like diabetes, obesity, and such like are not available at the moment. You can't get to see a doctor for treatment in the public sector. If you are wealthy enough to afford the private sector, of course, you do not feel the impact of the pandemic. So even in issues like health access, you will have the same problem of an emerging inequality. I think the same is probably true in Europe of access to education, where educational establishments have not been running now for a year at full steam, and people's education, particularly in the public sector, has fallen behind where it should be. And this is going to have an impact, for example, on the access or the skills that young people need in order to have careers in the future. So I also have an age inequality issue as well. So there are lots of different forms of inequality that are impacted by having a pandemic. And let's say a pandemic because it's not the first and it may not be the last. And I would like us to talk around the impact of the pandemic, not just in the economic terms, but also always to remember these ongoing social issues as well. I also would like to make an observation that perhaps the impact is going to be blunted in some of the more developed countries due to government intervention. For example, here in the UK, people who would probably have lost their jobs due to the economic downturn are on furlough with 80% of their salary being paid by the state. This is not an option in most developing countries. So I think that in itself creates an inequality because the government intervention is distorting the impact of the pandemic if we compare country by country. Now, I think I'd like to hear what Mitch and Judith's views are from their own geographical perspective, rather than hogging the whole of this. But again, I go back to the idea that pandemic is having an effect economically, socially on health and education, and also from a gender and age perspective upon inequalities between genders and between age groups. Okay, I think I've given enough big topics to talk around for the moment. What do you think, Mitch? Can you put your microphone on, please?
Yep, I'm on. Thanks, Stephen. I would have to say that you've correctly hit on all the various aspects of inequality. I guess from my perspective, almost all disasters of any kind have a disproportionate impact on the poor. So whether we're talking about, if we talk about Indonesia, where I lived for many years, where you have volcanic eruptions, you have floods, you have tsunamis, inevitably it's the poor that are more impacted by any kind of disaster, including the COVID impact, than other groups. Of course, COVID is very different from a volcanic eruption, so it's not going to be exactly identical. But I'd still put it under the general framework of disaster risk management and how countries adapt to disasters. Since I'm a pension expert, that's really my main area of practice. I'll look a little bit at the impact on the elderly, because it's interesting how COVID impacted the elderly compared to other age groups, as you've referenced briefly. In some ways, the elderly are suffering more, and in some ways, they're suffering less from COVID. Certainly in terms of the health risks, we know that the health risks to those who are 65 and older, and particularly those that are 75 and older, are much higher. And certainly anybody who's immunocompromised, people in nursing homes where people are crowded together and people are elderly and sick are particularly vulnerable to health risks. On the other hand, when you look at the responses to COVID within the bank, for the most part, on the income side, on the economic side, many of the elderly are not impacted nearly as much as the working age people, and particularly blue collar workers, and particularly workers who are first responders, and particularly workers who are in the service sector, especially those working in restaurants and small businesses and that type, because for the most part, they've got, if they were fortunate enough to have pensions, their income is protected and they're not losing their pension income as a result of COVID. Of course, the pension systems are losing revenue and the pension systems are running bigger deficits and the pension systems are under greater financial pressure, which may have an impact down the road. Also, some pensioners who are in defined contribution plans have access to early withdrawals. And some governments have chosen to permit greater amounts of early withdrawals. And those who are taking money out to support their current consumption are going to find when they actually retire down the road that they're going to have significantly less money. So again, it may be more of a longer term impact. Switching away from the elderly, certainly I agree with you on education. The impact of the shutdown of schools and the move to virtual education varies a lot depending on the infrastructure, depending on the availability of internet, depending on the availability of computers. And certainly younger children have a much harder time working with distance learning than some older children, though some older children are also suffering tremendously. And there's the social aspects, the isolation for both the elderly, the isolation that kids feel by not going to school, that are having social, negative social impacts. And certainly in the U.S. and in other countries, it's the poor that are dominantly suffering the most from COVID. They're the ones most likely to lose their jobs. They're the ones that are, that tend to live perhaps in more crowded conditions. They tend to live in multi-generational families. And so it's much easier for COVID to spread in some of those communities than it may be in others. And disproportionately, the poor have been much more impacted by COVID than the wealthy. And white collar workers, like ourselves, who are fortunate, who work from home and who have good quality internet and can do our jobs from almost anywhere, are certainly been much better off during this crisis than others. I'll stop there. Okay.
Can we hear from Judith a bit? Because I'm very interested to hear what she has to say from an African perspective. Yes. I don't want to steer what you talk about, dear, but I'm very interested because I think Mitch, Victoria, and I are looking at it from the perspective of vaccination and similar things, whereas the situation in Africa may be completely different. So how do you understand the impact, for example, in Nigeria of the pandemic?
Thanks, Dave. I would just put it that the COVID situation has largely exposed the inequality between the rich and the poor in Nigeria, in Africa, and in other countries, the developed countries. Whereas it looked like there are healthcare facilities, the economy in other countries are stable. Like you mentioned, that when people get out of jobs, they are either being followed by the government and they've got some support. In Africa, in Nigeria, about 80% or more, when you lose your job, it is between you and your next meal. So the COVID situation has showed the weakened government structures which we have, the weakened infrastructure which was almost non-existent, that lots of support was coming from the international, from the developing countries, the developed countries, and has also widened the gap between the rich and the poor, because the level of education in understanding the coronavirus, it's very diverse, it's very different. Whereas it's amazing how the data looks, because with the level of poverty and with the population in a country like Nigeria with over 200 million people, you would imagine that the death rates will be really high. And because they are not saying that, there is no evidence where the numbers have really been escalated. About 2,000 people have died from COVID in Nigeria. 169,000 people have been affected, but only 2,000 people have died. And so that makes people very reluctant to even believe that COVID exists, right? There's a huge disbelief of COVID because they're not seeing people dying. And so that wide gap between the rich and the poor, where the haves and the have-nots, and where the haves can see that the haves can actually see people dying, people being hospitalized. They are actually educated to see what's going on. It just shows where Africa is and the kind of structural work that needs to be done, the kind of infrastructural work and government policies that need to be done in terms of healthcare. Generally, I mean, having healthcare is people just self-medicate, right? And to the point where it's not really affecting lives. Beyond what we see now in the economy has really dipped. And so managing or understanding the impact of COVID on the economy, where a major source of income, which is oil, is dipping because of COVID. The manufacturing companies are all shut down. Many companies are all shut down. Understanding that and relating it to COVID for the 70% of the population which live below $1, it's very difficult. However, the presence of COVID impact in Nigeria is enormous because the exchange rate, everything has tripled, but it's quite difficult for people to relate and, you know, put likes to like and see the impact or the implication of COVID in Nigeria. I'll stop there for now.
No, I mean, the points you make are very good. In fact, you're forcing me to ask you a couple of questions immediately because what you've said is so interesting. The first thing is you report a very low incidence rate or very small numbers affected medically by COVID. Yeah. So my first question would be, is that a low incidence of COVID or a low quality of reporting on the health impact of COVID? Yeah, because I don't know, in Europe, governments publish on a day-by-day basis possible in countries with a much weaker health management infrastructure. That's the first question I'd like to ask. And the second thing I'd like to throw a more general discussion. Economic impact, for example, in the example of Nigeria, an indication that there used to be an old joke that you get that, Mitch? And I said, if America sneezes, the rest of the world economy catches a cold.
It used to be that way. I think it's getting to be less over time, and 20 or 30 years from now, that probably won't apply at all.
Well, future Xi Jinping sneezes and the rest of the world catches a cold. But is what is happening in Nigeria in the economy actually an indication of over-dependence of the problem? For example, we have a relatively small drop in GDP annually at the moment, but it has a much bigger impact on you as primary producers. So in fact, you are, I don't know whether you're getting COVID, but you're certainly catching the economic impact of COVID upon us. Okay, so the first question is it a question that you have poor reporting on the real cases of COVID in Nigeria?
So maybe question, Stephen, and your connection might be more stable and you could ask me the second question again. because it is a glitch and I can't really hear you clearly. So it's a really good question you have asked. It is a lack of testing for the COVID. People are not testing enough. We believe if people test enough, with more tests being done, you have a mere cold or a fever, you do the testing, we might have a higher reporting on COVID cases. That's one. The other thing is, with the weak structure of the healthcare system in Nigeria, we know that we will not be able to manage all the incidences that might fall out of COVID, having ICUs, having the ventilators at that time and all that would have been required. And so knowing those two things, one, we're not testing enough, there's not enough tests going on, except when people that are the middle class and the upper middle class want to travel, they are required to have a test. So there is not a massive test going on. There is also not a fantastic or near good healthcare structure in the country. However, we're not having deaths. I mean, the death numbers have not increased. If they have increased, it should have somehow been reported or getting to the ears of everyone, or just on the streets from the hospitals that people are dying in their communities or from the hospitals. That is not also happening. And so people are finding it difficult to say, we don't have this healthcare facility to manage these situations. We have isolation centers that are literally empty right now. I mean, they've been empty from November. People are not wearing their mask, right? People are not dying, but a few number of people are dying, which is the wide gap between the rich and the poor. And it's very much like, and I'm not going to go into science and research and all of that, but it seemingly looks like the poorer people are not having the COVID, and the people who are well off and who are quite successful, who are upper middle class and middle class, tend to be the ones having the COVID, who are educated, who know they should get tested when they don't feel well, who go to the hospitals and all of that. So there's that kind of disbelief versus what they see and the actual situation and what WHO tells us and CDC and NCDC tells us about COVID-19. But what people really see, because on the street, some days I go out and I'm counting to see how many people are actually wearing face masks. On a 5-minute drive, I could see 10 people if I'm lucky, right? In the markets, in really crowded places, you don't get anyone wearing face masks. And when you do go in wearing that face mask, you look like, you're being ridiculed actually for wearing this face mask. But I mean, I know enough to keep myself protected, and that's what it really is. One, no testing, poor healthcare, but it's not correlating to the outcome of the number of deaths that we should be experiencing beyond the impact on the economy.
Okay. Can I ask you,
Stephen, yeah, the connection is breaking. It's we are not didn't hear the last question.
well, I think I want to leave aside the last question for the moment and come back to it.
Yeah,
has any comments to make yet?
Yeah, it was hard to hear what you were asking. I just wanted to maybe chip in and just ask Judith, as we're talking about inequalities, comparing different countries. Have you seen also some inequalities developing maybe within your country, within Nigeria, as a result of COVID? Because we know obviously that, yeah, comparing to, let's say, the Western world situation is very different, but within the country, have you seen the impact of COVID on inequalities within the country?
Yes, I would put it down to the less education people have, the more they are likely to disbelieve that there is COVID, right? And so because the larger population of Nigeria is poor, they have been without jobs, they live below $1. The rate of job losses that has affected the country hasn't really hit them as you would expect, but there's a higher probability that it is affecting their income because the middle class, that bubble, have lost their jobs, and so they cannot afford to get things at the lower levels. So they are experiencing they are experiencing reduced number of activities in their businesses. They understand that there's a lockdown, and there is also loss of revenue for them. But I mean, tying the implications of what COVID is doing to the poorest, where more than is about 80% of the household that are poor, it's difficult to see it. And so their thinking is, oh, we can have our lives back as normal. So there's this really wide disparity between the 20% who are well-to-do and the 80% who feel this COVID is not, I don't know what's going on. I don't believe it. And with the health centers opened and vaccines going on, people are taking vaccines. The people I have asked from the lower rung of the economic status are not interested in taking the vaccine, just to put that out there.
Wow, yes, and thank you for the answer. We've been having this question from Anya, who, as I know, she is very interested in the impact that COVID might be having on education and whether that impact will be felt 10 or 20 years from now. Do you have any comments on this? Maybe Mitch?
Thanks. Thank you, Vita. 10 to 20 years out, it's harder to say. I would say certainly over the next 5 to 10, the answer from the research that I've seen, and I'm not an education specialist, but from the research I've seen, absolutely. It seems that kids are falling a year to 2 years behind as a result of the shutdowns from COVID. So for younger children, it's especially severe, but even for people at the high school level, university level, technical colleges, yes, it seems to be having a permanent impact that will carry out well into the future. I don't know if it'll go out 20 years or not, but it certainly will have an impact long beyond the end of COVID. Thanks.
Thank you. Thank you.
I quite agree. The problem is also the quality of the education that is possible when it's all done remotely. Yes, I'll give an example. It's a real problem. It is quite possible to do theory remotely, but you can't do an experiment remotely. Did you hear that?
Yeah, the connection, I'm so sorry, Stephen. Yeah, the connection is on and off. I think when you get closer to the microphone, maybe it gets a little bit better, so.
Right, I'm about 3 inches away at the moment.
Okay.
Unless I suck the laptop, yes?
Yeah, it really breaks up regularly, unfortunately, Stephen. We hear a few words and then it gets very garbled and we can't understand you at all.
It's the quality of the IP rather than the quality of my ideas. But I mean, the point was that some forms of education are amenable.
It's not working.
Yeah, I'm so sorry. Yeah, well, again, we are live, so sometimes there are technical issues on the way. I know Stephen has a lot to share, but just this, is there any way, Stephen, you can maybe, wiggle something like on your end, just make it, because really would like to hear a little bit better.
The points that Stephen are trying to make is true that by subject it varies. Some children are much better at dealing with remote learning than others. For some, the social aspects of school are critically important, and the isolation resulting from it is different. Some kids have much more, attention focus than others. A lot don't even have internet or have, problems like you have right now, Stephen, where they could be online and not even be able to hear what the teacher is saying. And then again, to one of your points, Stephen, if you're looking at science, for example, you're right. You can get a science class online, but you can't do labs online. There's certain things that can be done online, and there's certain things that can't. So at all educational levels, I think the challenges of remote learning may be different. And then there's the impact on parents. To a large extent, parents are having to make up for the role of teachers, and the parents are in effect homeschooling their children. And of course, this impacts the ability of the parents to work and to earn a living. And a lot of times there's a trade-off between caring for your children and their education and trying to earn a living at the same time.
Right.
Thank you, Mitch. Anya is giving us a suggestion. She's saying maybe earphones would be helpful.
No, I think it's the microphone.
And
it's
yeah,
the internet. It's IP. Yes.
yeah. Well, yeah, yeah. That's just very unfortunate that the connection is breaking, and I hope you can hear what we're saying. So, but yeah, we just basically hear on like just a few words on and off. But while we still have a little bit of time, maybe we can touch upon the topic of, is there anything that can be done? Because yeah, of course, we already identified quite a few problems, and we see that COVID does affect inequality in all the aspects. It's economically, socially, digitally, in all areas. Is there anything, in your opinion, that can be done and to alleviate that and to still follow the guidance of the Sustainable Development Goal number 10, which basically tells us that it is necessary to reduce inequality within and among countries? Maybe Judith, do you want to say what you think can be done?
What I think can be done is, and I'll just put it to the media, right? The kind of information that comes from the media, when is educative as opposed to creating fear, is something that can be done. And so the information that makes it look, that creates an even wider gap, like what kind of vaccines are they bringing to Africa? Is it the vaccines that have been rejected that is coming to Africa? What would the vaccines do to people? If we get this first batch, what happens to the next batch? That level of skepticism makes it even difficult to deal with this pandemic, because whether we like it or not, if Africa doesn't have it and is not feeling it as the rest of the countries where the climate is colder, it doesn't mean that it is not real. So with the right communication and the media saying very much the right things, like we are all in this together and not US or Europe and this is what's happening and borders are closing. If we are living without borders, like consulting without borders, in this situation, it's something that will help. Thank you.
Thank you very much. Yeah, I totally agree with that. Mitch, do you have something to add to that from your perspective? What can be done to help or to ease the impact of COVID on inequalities globally?
Well, Judith's made a couple of interesting points as we've been going along. Everything that you say about the media, Judith, is just as relevant in the United States as it is in Nigeria. The In my view, there's very few independent media in the United States that presents both sides of issues in a clear fashion. And most of the media is more in the nature of propaganda and more in the nature of supporting the beliefs that people already have. It's amazing how many people don't believe in COVID in the United States. It's amazing how many people think that the vaccines are going to put some kind of tracking device into their body, so that Bill Gates can track us all over the world, and that the government is trying to make us infertile with these things. So it's astonishing how much this is believed in the United States. It's astonishing how many people are refusing to get vaccines in the United States. So, a more objective, less fear-focused media would certainly be good. The second thing that Judith said earlier that I think is really important is that, to a large extent, inequality is swept under the rug, but COVID has made inequality more visible. And that in and of itself is a good thing, because we're more likely to be able to get focus on it, because COVID has accentuated just how much inequality there is, and has accentuated the degree of inequality. I mean, in the United States, I saw an article that the richest 10 people in the world have gotten $6 trillion richer during COVID. And in the United States, we already, and in much of the world, we already have a hollowing middle class, and we have and in most countries where I work, we have maybe a 13% poverty rate, but we have about 40% of the population living just above the poverty rate that's vulnerable. And there's a remarkable movement above and below the poverty line from one year to the next. Just any little shock of any kind can take a family that's just above the poverty line and throw them under the poverty line. And so there's this very fluid movement there. So any kind of little shock like this can really accentuate inequality. And, this is not a particularly easy issue to deal with, but hopefully the focus that COVID's bringing to it will help governments to become, to pay more attention to inequality and to the negative consequences that it has, not only economically, but for social unrest. I mean, there's fairly good evidence that any coefficient reaches a certain level, it has a direct impact on social unrest and social stability in the country. I'll stop there.
Any other comments or suggestions? As I totally agree with both of you about communication. And again, as we see, this problem is not only in the African countries, doesn't only exist in Nigeria, but it is in the United States, where supposedly we should be, better educated maybe on on certain issues. But clearly, the problem is probably very similar all over the world. So the way that the role that the media plays is very important. What I was trying to say is that perhaps in the United States we have more capabilities to maybe educate about this a little bit better, but unfortunately that's not the case. Is there? I'm afraid to ask Stephen to say anything. I hope we can hear you, but it would be great to hear, of course, what you're thinking.
Well, I wrote in the private chat, can we discuss gender issues?
Oh, actually, we can hear you well now.
Well, probably.
Yeah, gender issues would be great.
I'm interested in the gender impact of COVID as well.
All right. Well, we can hear you now. Whatever the magic that you played there with the microphone or your ear, it worked.
Yeah,
at least to some extent. So we do have a few minutes left. So maybe we can then hear some comments from Judith and Mitch on gender issues, because we can probably, from some of the statistics that I've been seeing, women have been impacted more than men, and that's just the statistics. That's the fact. So anything that you could say to that, Judith?
Right. So there are two sides to it. If I look at it this way, in terms of women in the workplace, they have been affected hugely by the coronavirus situation. Yes, performance has gone down. across the board in many organizations because of remote working. Women have been affected the most in terms of that. On the flip side, what the news says, I'm just referring to what Mitch did mention. We don't know what the news says, but what we hear is men are more affected. Men get the coronavirus more than women, right? So there's the side where women are not really, I mean, the data says women do not come down with the virus as much as men do. But in the workplace, women have been really affected by the virus, particularly women who have children, women who have young children going to school from home, and the workplace is unable to provide the kind of flexibility you would need to look after your children and support them from school, which is, it's a natural maternal instinct to look after the children and provide the kind of support they need. And so it's just taking women back to, in my opinion, the 1950s and 60s, where women have been the primary caregivers of the family, because the responsibility of managing the child's working from home is usually on the mothers, helping the child to do well in school, the responsibility of grocery shopping, the responsibility of providing food. It's an additional responsibility that was managed in a very different way, but is hugely now for the women folks to manage. And I could speak for my organization, DAI. When we do the monthly report, it shows that the performance of women has been affected. As much as we try, the women try to keep it up and to measure up. There are just things that a child is coming down with a cold and you have a meeting. They're just things that is really, coronavirus had made women kind of go back a couple of decades to being the primary caregiver, and then fast forwarding them to the 2020 mindset of wanting to have a seat at the table. Thank you.
Mitchell, do you have something to add to that based on your experience?
No, I would agree with most of what Judith is saying. I mean, we look at certain groups of workers. Well, we look at certain groups. For example, the elderly, especially the elderly over about 75, are dominantly women. So, you know, when you look at the nursing homes and who's impacted by COVID among the elderly, it's obviously going to be having a bigger impact on women than men. Then if you start to look at the groups of workers that are most exposed to COVID, you start to look at healthcare workers, teachers, and first responders. You know, certainly for teachers and healthcare workers, they're going to be dominantly female, and they're in jobs that are going to expose them much more to COVID risk than other groups. First responders is probably a little bit more when you start looking at police and ambulance. Again, some of them may be more male, though again, once you get to the nursing level and to the hospital level, it's largely female. In terms of loss of jobs, you know, I'd have to agree with Judith. The women are more at risk of losing jobs and are more likely to become the caretakers and the homeschoolers to the extent that that's needed when kids are not in school. So again, there'd be more of an impact on women there. So some impacts on men, but more so on women.
Thank you. Thank you. There was a question that Stephen posted to us, and Stephen, do you want to try to say it's about the poverty lines that you wanted to ask about, and whether they should be reviewed in developed countries with regard to the pandemic?
I mean, you can hear me okay. It's because
No, yeah, we cannot hear you, unfortunately, but that was the question that you posted in our private chat, and maybe Mitch, do you want to take on that one?
Not so much developed countries, but I'd like to talk about poverty lines in developing countries. You know, we like to think that poverty line is something that's very well defined and there's a clear definition and everyone follows it around the world. And but, you know, poverty line is political. Different countries choose different poverty lines depending on how they want to present themselves to the world. So if you want to present yourself as poor and needing aid, you measure poverty in one way. If you want to present yourself as making progress and reducing poverty, you skew your statistics or you skew your line in another way. So something that you would think would be something scientific is actually not. And I find that different countries have different lines, and they choose them because they're trying to communicate a very different message about their country to the world. So I can't comment on as much on it in developed countries, even. You may know something more than I do about that question.
No, I wanted your opinion. Okay. Thanks.
Thank you very much.
I don't know what to say about developed countries. I've very rarely looked at how poverty lines are measured in the United States or Europe.
All right. Well, we are almost at the end of our 1 hour of conversation of this very important dialogue. And I apologize for some technical issues that we've been having. I guess this is,
First attempt.
This is unavoidable sometimes. So I would like to thank you all for participating, and just before we end this broadcast, just maybe give you 30 seconds to 1 minute, just add something as related to our topic of conversation or anything else that you would like to say about this broadcast or in general about the situation with the COVID or inequality. Judith, any the last comments?
My last comment will be that the pandemic, which is very unfortunate, is one of the situations that have brought us as a world, planet Earth, even closer, because the situation in the UK, in the US, in Africa, in Asia, it's not different. We were facing same situation in education, same situation in health, same situations in employment and standard of living. That this is a time that we really need to pick up and talk about how we are one globe, because what affects one is likely going to affect everyone else, regardless of the extreme level of poverty in Africa and Asia, where it's eating the hardest. But this would also lead to migration. It's a topic for another day. Migration from those countries. So what affects one actually affects all of us in the global human development that we are all in.
All right, thank you. Before I let you go, do you have any suggestions? What topics we could be handling next time that we meet? And of course, we will be bringing more speakers, more experts. But anything that you would think will be important to discuss related to COVID or inequality or any other sustainable development goal that is probably particularly important at this time?
There was a comment that I saw from Stephen, which made me think, government capacity to support SDGs and small businesses and entrepreneurs. Yeah, that would be a good topic for us to have. In their role as donors, small businesses, how would that work? Yeah, I think that's a good one.
Okay, thank you very much for your suggestion. Mitchell, do you have any last comments for us today, and maybe some suggestions for our future topics?
I think this is one of the interesting things to me has been to observe how different countries have reacted to COVID. From, let's say, the United States at one extreme, which is, tried to implement a fairly big shutdown at one point in time, loosened up now, obviously, but $6 trillion, shut down the economy and then help everybody who's impacted by pouring $6 trillion so far into the effort. At the other end, Stephen, it was interesting. I noticed you said you live in Bulgaria. Bulgaria, I think, is sort of the other end of the spectrum, where they've simply said, we either don't believe in or we can't afford to spend that kind of money. We can't afford to shut down our economy. We can't afford to pay everybody. And we're just and we don't want the overhang of debt that's going to come from having to pay off all of this money down the road. I mean, how are we going to pay back all this money? And what's the long-term impact of this $6 trillion that the U.S. has spent? What's going to be the impact on our economy, our taxes, our growth rates, and everything else down the road? And other countries have said, either philosophically or financially, we simply can't afford this. We're going to keep our economy open the best we can. We're going to take the extra deaths that come from this. And when we come out of this thing, we're going to have much less of a debt overhang on our economy than we had before. And we're not going to take jobs away from people. We're going to let them keep working, and we're going to take the risk. Because a lot of this has to do with choosing the best of bad options. Yep. Different countries have made very different choices for very different reasons, either demographic or economic or otherwise. And that's been very interesting to observe what choices they've made and to see what the long-term ramifications of that are going to be. Yeah. But yes, Stephen, migration is a great topic. This whole issue of poverty lines, the nature of poverty and how the nature of poverty differs in African countries or Southeast Asian countries versus Western countries is also a really good topic to discuss. But luckily in the World Bank, our mission is to eliminate extreme poverty and to focus on the growth rate of the bottom 40% of the population. I think that's still the right thing for us to be doing with or without COVID, and I hope that's what we'll continue to do.
Thank you so much. Thank you so much. So this brings us to the end of our discussion, and of course, our audience can also give us suggestions for our next topics, or at least stay tuned. And this is the website for the foundation where we will be posting the updates of our activities, our future episodes. Always welcome the feedback from anyone. So I thank you very much again for joining us today. And I really hope to stay in touch and see you in our next episodes, Consulting Without Borders Live, Global Challenges. Thank you, everyone. Have a great day.
Bye, everyone.
Bye-bye.
Bye.